How often do you think about your health? Are you aware of the silent signs your body might be giving you about potential diseases? Today we introduce you to John, a man who didn't heed these silent signs until it was too late. John's journey is a harsh wake-up call of why we need to be knowledgeable about diseases like pancreatic diseases and their early symptoms. John initially brushed off his symptoms as inconsequential, leading to a diagnosis of advanced pancreatic disease. His story is a warning, emphasizing the significance of being informed and watchful about our health. Let's dive into the 8 early signs of pancreatic diseases, the signs that John overlooked. We hope that his journey will motivate you to take your health more seriously, so buckle up and let's get started. The pancreas is a small, diligent organ is akin to a bustling kitchen, crafting digestive enzymes to break down food into energy and regulating our blood sugar levels. So, what happens when this vital organ falls sick? Pancreatic diseases can wreak havoc on this smooth-functioning organ, leading to grave health complications such as malnutrition, diabetes, or even life-threatening conditions like pancreatic cancer. These diseases can range from inflammation or pancreatitis to harmful growths known as cancer and mucus accumulation due to a genetic disorder, cystic fibrosis. Now, before you get anxious, remember that knowledge is your best defense. Early detection of these diseases can lead to prompt and effective treatments. So, here's another question for reflection to you. Do you know what the early signs of pancreatic diseases are? Let's together remember, awareness is the first step towards a healthier life. The first early sign is jaundice, a yellowing of the skin and eyes. This is a symptom that should never be brushed aside, as it often indicates a serious condition. In the context of pancreatic diseases, jaundice develops when a tumor grows in the head of the pancreas, obstructing the bile duct. This blockage prevents bile, a fluid produced by the liver to aid digestion, from reaching the intestines. Normally, bile helps break down fats and eliminate old red blood cells, but when its passage is blocked, it accumulates in the bloodstream. This buildup results in the yellowish discoloration we associate with jaundice. It's not just the skin and eyes that can turn yellow, but sometimes even the urine can darken and the stools can turn pale. But why is jaundice such a significant sign? Well, it's because the location of the tumor in the pancreas that causes the jaundice is easily detectable. It's often spotted before the cancer has a chance to spread, making it a crucial early warning sign. However, it's important to note that jaundice can also be caused by conditions other than pancreatic diseases, such as hepatitis or gallstones. So while jaundice is indeed a warning sign, it's not a definitive diagnosis. Always consult a healthcare professional if you notice any yellowing of the skin or eyes, so noticeable yellowing is not to be ignored. It might just be the sign that leads to early detection and treatment of pancreatic disease. Next, we have abdominal and back pain, which is often severe. When we talk about pancreatic diseases, these are symptoms that can't be ignored. It's important to remember that the pancreas is nestled right in the abdomen center, behind the stomach and close to the spine. Its central location means that when something goes awry, it can lead to discomfort in various areas. The pain experienced due to pancreatic diseases is often described as a persistent, dull ache that seems to radiate to the back. This happens because the pancreas is inflamed or because a tumor is pressing against nearby organs or nerves. The pain might worsen after meals or when lying down, making it hard for those affected to find a comfortable position. Now, it's worth noting that abdominal and back pain are common complaints and can be associated with a wide array of conditions. However, when these pains are persistent, unexplained, or accompanied by other symptoms we've discussed, like jaundice, it's a clear sign that something may be amiss with the pancreas. In essence, any pain that's unusual, severe, or chronic should be checked out by a healthcare professional. It's always better to err on the side of caution when it comes to your health. Remember, early detection is key in managing and treating pancreatic diseases. Persistent pain in these areas is a signal that shouldn't be brushed off. Unexpected weight loss and new onset diabetes are also early signs. Now, this might seem a little puzzling. How can a disease of the pancreas, an organ tucked away deep in your abdomen, lead to changes in your weight or blood sugar levels? Well, the pancreas is an industrious little organ, and when it's not functioning as it should, it can upset the intricate balance of your body's systems. You see, the pancreas plays a key role in digestion. It produces enzymes that help break down the food we eat. When the pancreas is affected by disease, it may not produce enough of these enzymes. As a result, your body might not be able to absorb all the nutrients from your food. This can lead to weight loss, even if you're eating the same amount as before. On top of that, the pancreas is also responsible for producing insulin, a hormone that regulates the sugar levels in your blood. If your pancreas is under stress from disease, it might not produce enough insulin, leading to high blood sugar levels and potentially diabetes. These changes can be subtle and easy to dismiss. You might think you're shedding pounds because of a new diet or exercise routine, or you might attribute higher blood sugar levels to aging or stress. But when combined with other symptoms like jaundice or abdominal pain, they could be early warning signs of pancreatic disease. So what does this all mean for you? It emphasizes the importance of listening to your body and paying attention to changes, however small they might seem. If you've been losing weight without trying, or if you've been diagnosed with diabetes out of the blue, it's worth mentioning to your doctor. After all, these signs are your body's way of telling you that something's not quite right. And remember, while these symptoms don't definitively mean you have pancreatic disease, they do warrant further investigation. It's always better to be safe than sorry when it comes to your health. If you're losing weight without trying or have sudden diabetes, it's time to check in with your doctor. Digestive problems and itchy skin too could hint at a pancreatic disease. When the pancreas is in good health, it releases enzymes to help break down the food in our stomach, aiding in proper digestion. However, with an ailing pancreas, the release of these enzymes is hindered, resulting in undigested food making its way through the digestive tract. This can lead to a host of digestive problems, including bloating, gas, diarrhea, and even unexplained weight loss. Now, let's take a moment to understand why these symptoms are significant. When your body is unable to digest food properly, it means that all the essential nutrients from your meals aren't being adequately absorbed. This malabsorption can lead to nutrient deficiencies, which can have far-reaching effects on your health beyond just your digestive system. But how does itchy skin come into the picture, you might ask? Well, a diseased pancreas can also lead to jaundice, a condition characterized by the yellowing of the skin and eyes. Jaundice occurs when the liver cannot process a substance called bilirubin, often due to blockages caused by pancreatic diseases. This accumulation of bilirubin in the body can cause the skin to become itchy. While itchy skin might seem like a minor inconvenience compared to the other symptoms we've discussed, it's crucial not to dismiss it. Persistent itchiness, especially when paired with other symptoms, could be your body's way of signaling that something is amiss. In conclusion, digestive problems and itchy skin might not be the first symptoms that come to mind when thinking about pancreatic diseases. However, their presence, particularly if persistent, should not be overlooked. They could be the early signs pointing to a potential issue with your pancreas. The key takeaway here is the importance of listening to your body and taking note of any changes, however small they may seem. Remember, persistent digestive issues and unexplained itchiness warrant a medical checkup. It's always better to be safe than sorry when it comes to your health. Lastly, blood clots and abnormalities in fatty tissues are early signs of pancreatic diseases. Let's delve into why these symptoms occur and why they're so important to note. First, blood clots. You might be thinking, what does the pancreas have to do with blood clots? Well, the pancreas plays a key role in digestion and hormone regulation, including the hormones that affect blood clotting. When pancreatic diseases strike, they can disrupt these functions, leading to an increased risk of blood clotting. These clots often form in the large veins of the legs, a condition known as deep vein thrombosis. Deep vein thrombosis can be dangerous because it can cause clots to travel to the lungs, leading to a life-threatening condition called pulmonary embolism. Now onto fatty tissue abnormalities. These are areas of fat that have an unusual appearance or texture. They can be found anywhere in the body, but are often associated with the pancreas in the context of disease. When the pancreas is diseased, it can start to break down fat improperly. This can lead to the formation of these unusual fatty tissue abnormalities. You might see these abnormalities manifest as odd, patchy skin discolorations, or your doctor might detect them during a physical examination. Both blood clots and fatty tissue abnormalities might seem like minor issues or unrelated to your pancreas, but they're not. They're like the body's way of sending up a flare, signaling that something's not right. It's important to remember that these symptoms don't always mean you have a pancreatic disease. They could be the result of other health conditions. But if you're experiencing these symptoms, especially in combination with others we've discussed, it's important to consult with a healthcare professional. These signs may seem unrelated to the pancreas, but they are crucial to watch out for. Your body is a complex system, and when one part isn't working right, it can send ripple effects throughout. Be proactive and keep an eye out for these early signs of pancreatic diseases. In summary, the 8 early signs of pancreatic diseases are jaundice, abdominal and back pain, sudden weight loss and diabetes, digestive problems, itchy skin, blood clots and fatty tissue abnormalities. These symptoms, while common in many conditions, can indicate a problem with the pancreas when they occur in conjunction. Jaundice, characterized by a yellowing of the skin and eyes, is often one of the first signs of pancreatic disease. Abdominal and back pain, while common, can also be indicative of a problem when they are persistent and unexplained by other factors. Unexplained weight loss and the sudden onset of diabetes can be a clear sign of trouble. The pancreas plays a key role in our digestive system and the regulation of our blood sugar levels. When it's not functioning properly, these areas can be directly affected. Digestive problems and itchy skin are also significant. Itchy skin can often be a result of jaundice, while digestive problems can be due to the pancreas not producing the necessary enzymes for digestion. Lastly, blood clots and fatty tissue abnormalities. These are serious signs that should never be ignored. Blood clots can lead to serious health complications, and fatty tissue abnormalities can be a sign of pancreatitis. Awareness is the first step towards prevention and treatment. Paying attention to these signs and seeking medical advice if you experience them can make the difference between early detection and treatment or more serious complications. Remember, you are the best advocate for your health. Stay vigilant, stay healthy.